Every man, woman, and child in the United States should have access to health care. Hundreds of thousands of people in the United States die every year simply because they do not have health insurance. As a physician, I can tell you firsthand how outrageous it is for someone to die because he waited too long to get care because he had no insurance. This is unacceptable in a country that has signed the United Nations Declaration of Human Rights, which states everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including food, clothing, housing, and medical care, and necessary social services. In 1977, the United States also signed the International Covenant on Economic, Social, and Cultural Rights, which recognizes the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. The core argument for the right to health care is the value we place on the individual's right to live a full, productive, and happy life. A child's right to education, a worker's right to a safe workplace, and the public's right to a safe and healthy environment are guarantees that we have come to expect in American society. We also recognize the need to ensure access to certain basic medical treatments for the good of society. Public health laws require individuals to be immunized against communicable disease that, if left to spread, can cause death and disability. Prisoners have a right to health care while they are incarcerated. These policies stem from recognition that individuals have a right to health and government can guarantee that right. If health care is not a basic right, it means we are a society that believes that we should allow individuals, including children, the elderly, the disabled, and all others, to suffer or die when they are sick or injured simply because they cannot pay for effective care or treatment. The only alternative to health care as a right is health care as a privilege for those who can't afford it. Those who argue against health care as a guaranteed right ignore the fact that historically the definition of rights to which Americans are entitled has evolved over time. These include the right to vote, the right to own property, and the right to education. There was little available in the way of medical treatment in the time the Constitution was signed. Health care as we know it today could not have been envisioned by our forefathers. We have made advances in public health knowledge and practice in medical care over the last century. It's clear that having a sensible social policy on the applicability of this knowledge for the greater good is a role that only government can assume. Government must ensure that everyone has access to health care. This does not mean that government must run the health care system. However, it must ensure that individuals have access to affordable quality health care. And if individuals do not have insurance, government must provide a functioning public health system and providers who will see individuals who cannot pay for their care any other way. Services provided by either the public or private sector must be accessible, scientifically and medically sound, and delivered in an ethical manner. Massachusetts has a public-private partnership that is working to ensure access to quality care. There are more than 300,000 newly insured individuals in Massachusetts. Because we have required individuals to have insurance and changed regulations, premiums for individuals are affordable and provide more comprehensive care. In summary, everyone is entitled to health care based on the inherent value that we in the United States place on an individual's right to live a full, productive, and happy life.